I'm honored to have someone in the studio who's not only a friend, but he's a guest right now who's going to give you some very important information. Dr. Brian Bausano is here with me in the studios. He is an associate professor of emergency medicine over at WashU. He's also on the staff as an emergency room doctor at Barnes and Mobap, and of course Barnes West County. And Brian, welcome into the program.
Thank you, Mark. Happy to be here. Thanks for all the fancy titles, but really today I'm here as a board member for the Missouri chapter of the American College of Emergency Physicians. There's about 600 ER doctors that are members of MOSEP, as we call it, and I'm on the board that represents them.
So as an emergency room physician, I'm sure we could fill an entire hour with stories of stuff you've seen walk in the door down here. However, that's not why you're here today. What you want emergency medicine to be used for is emergencies, correct? I mean, people shouldn't be hesitant to come to the ER if they've got what they think is a life-threatening situation.
Sure, I think the populist way of thinking about it is, oh, the ER is overused, but really we are there as the safety net for people when they are scared with certain medical conditions. And with the advent of Google and WebMD, if you Google anything, it pretty much says go to the emergency room.
Yeah.
Which is fine. That's what we're there for.
That can scare you to death sometimes when you Google some of that stuff. You got to be careful. That's for sure.
Exactly. I think the thing that concerns my chapter right now is people not coming to the ER when they think they have emergent conditions. And unfortunately, we've been battling with Anthem since this summer on an issue that I think is important to your listeners. Our thought is, over the past 20 years, part of the American dream is not just to own a house, but to get a good job with good health insurance. As it's become more costly, that seems to be one of the great benefits that you get with a good job.
Right.
Unfortunately, Anthem has decided this summer to test Missouri, Ohio, and Kentucky in basically what they call avoidable ER visits. So what they're doing is they're retroactively looking at the chart, taking your final diagnosis that the ER doctor gives you and saying, you know what, this is on our list of non-approved ER diagnoses. You pay the whole bill. We're not going to pay any of it.
That's like your car insurance company telling you after the accident that accident was avoidable and they're not going to cover your claim, right?
Exactly. That's the concern for us is, say you're a 55-year-old male who has chest pain, whether it's at work or at night, but you have chest pain. You're concerned. It's tightness in your chest. It goes to your arm. You think that could be something with your heart. You go to the emergency room. We work you up, EKG, chest x-ray, lab work. We say, you know what? We don't think you're having a heart attack. We think it's probably, something you ate and it gave you really bad acid and it made your chest hurt because that acid got up into your chest and your esophagus. Well, the problem is the insurance company comes back in and says, oh, your diagnosis is GERD or reflux disease. That's something a primary care doctor should diagnose. They don't look at the initial presentation, which was chest pain concerning for a heart attack. So they say, we're not gonna pay for this because you could have gone to your primary care doctor and got diagnosed with reflux disease.
What do you call? What's the term for this? It's layperson.
Yeah. So as part
standard,
of
is that what it is?
Yeah,
a layperson standard.
Prudent layperson standard. Part of the state and federal law, especially it was provided in the Affordable Care Act. Basically, it said that we are an essential health benefit to all American citizens. And based on the prudent layperson standard, which is a common person says, we think this is an emergency, then you cannot be denied insurance coverage to go into the emergency room.
So how's Anthem getting away with this?
Well, that's what we're fighting. So,
okay, yeah.
This is not a new issue. They tried doing it in the 90s and early 2000s, and this is one of the reasons it was written into the Affordable Care Act was to prevent this from happening again. And so they're trying it currently now and saying, under the guise of we're trying to keep the ERs from being too congested and people from using the ER too much. But our concern is if you look at this list of diagnoses, they sent medical directors around the state a list of 1,900 diagnoses that were ankle sprain, chest discomfort, shortness of breath. There were things on there that were very standard chief complaints that people, I think I broke my ankle. I can't walk on it. It's swollen up to the size of a grapefruit. I need to go somewhere now, and I need to get this x-rayed. And if they are closer to an ER or they're concerned it's broken and they skip an urgent care or don't call their primary care doc, what Anthem is saying is your doc could have diagnosed you with an ankle sprain. You don't need to go to the ER. We're not going to pay the bill.
I'm sure, and you may not be in a situation to be able to admit this, but I'm sure there are people who go to the ER for the wrong reasons. I'm sure there are. They do. It's a Saturday. They know their doctor's not in. They got a shortness of breath. They got a bad headache or whatever. They go to the ER. Maybe they shouldn't have done that. But your concern here is that for more serious issues, not the ankle sprain, but people believe they've got a broken arm or a heart attack, you're going to start seeing if people start getting in their brain, I may end up with a what did you tell me the other day? A $4,000, $5,000, $6,000 bill if they deny that coverage.
Correct.
They're not going to call 911.
Right. And I think that's the concern. Our national organization, the American College of Emergency Physicians, or ACEP for short, did a survey in 2016 that it showed that many Americans, about 4 in 10, reported that they delayed or avoided seeking emergency care in the past couple years, fearing the cost of copays, coinsurance, and deductibles. And nearly half of them had their medical conditions worsen as a result of that delay. So I think that's the concern, is that people could really be hurt by this. And the whole point of having insurance is for moments like this when you think something catastrophic is going on and you go and get it checked out.
Right. And you expect to have coverage. So has Anthem, I assume they're pushing back on this. They're going through with this, and they're adding yet another state. It looks like Indiana on January 1st.
Yeah, Indiana is scheduled to start this process on January 1st, and there's been a lot of media coverage in the state of Indiana as a result. Our organization at the national level, as well as the Indiana chapter, our partners, they also are fighting this as well. I think the biggest thing is that in this state, what we're doing to protect our citizens and our patients is our organization has gone to 2 entities, the Department of Insurance, which I wasn't even aware before this. There was an actual Missouri Department of Insurance, but there is, to talk to them about this. And basically, they've only had a few complaints so far. And so I think people just aren't aware, patients aren't aware that if they have this issue, they can actually report it to them. As a result, we also have approached Josh Hawley's office, our Attorney General, who was very open to our issue and is not investigating at this time, but he's reviewing our complaint. And I think the biggest message I can give your listeners and the public in general is, if you've had this happen to you where you have great insurance, you think everything's fine, you go to the ER and you get hung with the entire bill, that reporting it to the Department of Insurance is an important part of getting this fixed.
Right.
Because we can't claim that something illegal is going on until there's enough of that going on that they can open an investigation about it.
So why don't you hit those costs for me again that we talked about the other day? You said just a standard visit, somebody's in and out, maybe $4,000, but if you have to order a bunch of extra tests, that bill might be 10. Is that what you said?
It could be. If you end up with a CAT scan, let's say you come in with shortness of breath and you just came back from a long airplane trip, you could actually, and we want to do a CAT scan of your chest, let's say, to look for blood clots, which is a concern of many people after a long trip or being stationary. If we do blood work, we do an EKG, and we do a CT scan, it's very possible, depending on what's done for you, what kind of services you need in the ER, that your bill could approach that level. It's, of course, on a case-by-case level. But I think the important thing to keep in mind is your payment of that is actually pretty low. At least that's the understanding you have with your insurance company, is you have a ER copay and you have some deductible issues as well. But now people are getting the entire bill and just getting this crazy number that they have to pay.
Well, and sometimes, like, for example, if the insurance company did handle that $4,000 charge, the amount of that they're actually going to have to pay is considerably less than that, because they've got an agreement with the hospital system. But if the individual gets that bill, they're expected to pay the full bill, right?
Yeah, the FTC mandates that we have to give everybody the same bill, that we can't change the bill based on whether you have insurance or whether you do not. Mm-hmm. So everybody gets the same bill. But you're right in that insurance companies have negotiated with networks, or BJC, for instance, to get a certain discount off of the bill that they charge, and so they see those savings. Whereas if they give you the bill, the entirety of the bill, you cannot, and that's part of the rules that are set up.
Wow.
So I think that it's an unfortunate situation that I'm not sure what the motivation of the insurance company is, but it certainly seems to most people, and I think a prudent layperson, that if you think you have an emergency and you have insurance for emergency room visits, you probably should get your emergency room visit paid for.
It's a good point. And you have to wonder how much the healthcare reform discussion and the collapse of some of these Obamacare exchanges has put additional pressures on these insurance companies to maximize profits to make up for losses that they're eating in other areas. I'm guessing. I mean, I'm not excusing what they're doing. I guess I understand the drive for them to make more profit, but this is a life or death situation we're talking about, and a lot of people, if it's through your employer and the insurance your employer offers is Anthem, you don't have a choice of going out on an exchange and finding different insurance. That's what it is.
Yeah, I think that's one of our other concerns that we're trying to gather data on is are people that got insurance through ACA exchanges really being targeted here and being targeted with the avoidable ER visit issue with Anthem. I just want to bring up one more point. You made a comment earlier about, you're sure that people overuse the ER or are there that shouldn't be. And I think it's very easy for me or an experienced ER nurse or whoever to say, you shouldn't be here. But you know what? I have the benefit of 8 years of schooling. I have 4 years of residency. I've been practicing now for, almost a decade as an emergency medicine boarded physician. So it's easy for me to say, yeah, you shouldn't be here. But if you have someone who is, an accountant or a construction worker or any other field where they got their basic health sciences either in, high school or college, you don't know if you should be here or not.
Sure.
And that's, I think, the biggest issue is it's very easy to play Monday morning quarterback and go back and say, yeah, this person should have been here. Gosh darn it. But really, it's all about in the moment that you have that emergency symptom and that you have to decide, do I go to the emergency room or not?
Again, my guest, Dr. Brian Bausano, who is representing the American College of Emergency Room Physicians, giving you this information. Right now, all we can do is make people aware of it. Hopefully, your efforts, and maybe Josh Hawley gets in on this in the middle of what's going to be a Senate campaign for him. It'd be a pretty high-profile fight, I would think, for his office to look into it. Keep fighting the good fight. I'm hoping somebody's paying attention to this because you don't want to be the one that ends up with a $6,000 bill or decides not to go to the ER and dies of a heart attack sitting in your easy chair.
That's what we're trying to avoid. So I encourage people to go to mosep.org, which is our website if you have questions, but especially insurance.mo.gov. Contact us link, and ago.mo.gov, the Attorney General's office. If you feel that you've had this happen to you, report it, because that's the way we're gonna get this changes. We know it's happening, but people don't know where to go to complain about this and to file an issue. So please go to one of those three websites, and we'll try to keep fighting for the patients of Missouri.
Very good. Dr. Brian, thank you. Appreciate it. Thank you for coming down here on your day off. I appreciate that. 314-9